The 11 signs of prostate cancer that you should never ignore. If you are a man or know someone who needs to be mindful of his health, stay with me until the end of this video. Every piece of information here could serve as an alert for early detection and effective treatment. Before we begin, please hit the like button, subscribe to the channel, and turn on the notification bell to receive all the latest updates on health and well-being. Share this video with your friends and family because knowledge saves lives. Our health is our most precious asset, and prostate cancer is, unfortunately, one of the issues that most affects men, especially after the age of 50. However, many subtle signs may go unnoticed until the disease has advanced further. Today we are going to detail each of these signs, explaining what you need to watch for and when it is absolutely essential to consult a specialist. Get ready for some eye-opening and transformative content that brings knowledge and prevention into your daily life. 1. Difficulty urinating. One of the first signs that may indicate changes in the prostate is having difficulty initiating or maintaining a steady urine flow. If you notice that you need to exert extra effort to start urinating or that your stream has become weak, it's a sign that something might not be functioning as it should. This difficulty can be caused by an enlarged prostate, which may compress the urethra and interfere with the flow of urine. Even though these symptoms might be associated with other benign conditions, it is crucial to have a medical evaluation to rule out the possibility of prostate cancer. In addition, pay attention to whether this difficulty is accompanied by increased effort or discomfort during urination. Often, patients mistake this issue for normal aging effects, but ignoring it may delay early diagnosis. If you notice any changes in your urinary pattern, schedule an appointment and speak openly with your urologist. 2. Weak or interrupted urinary stream. Have you noticed that at times your urine stream seems to stop or become intermittent? This is another warning sign that deserves attention. An inconsistent urine flow can result from a partial obstruction of the urethra, usually due to an enlarged prostate. In prostate cancer, these changes may occur because the abnormal growth of cells interferes with the natural flow of urine. Many men might think that this symptom is just a temporary discomfort or related to a urinary tract infection. However, when this pattern repeats, it is essential to investigate its causes. Make sure to share this knowledge because an interrupted flow can be a silent symptom with serious implications for your health. 3. A burning sensation or discomfort. When urinating, experiencing a burning sensation or discomfort while urinating is a common complaint that can have various origins, but when it is associated with other symptoms, such as changes in the urine flow, it must be taken seriously. This discomfort may be an indication of irritation or inflammation in the prostate area. In the context of prostate cancer, the discomfort might initially be subtle, but tends to worsen as the disease progresses. It is important to note that this symptom can also be related to urinary infections or prostatitis, which are non-cancerous inflammations of the prostate. However, if the burning sensation comes along with other warning signs, such as difficulty urinating and the presence of blood in the urine, it is imperative to undergo detailed tests to confirm the diagnosis. Pay attention to your body and do not hesitate to consult a specialist. 4. Presence of blood in the urine or semen. Seeing blood in your urine or semen is one of the signs that most alarm patients, and with good reason. This change can occur due to various conditions, but when it is related to prostate issues, it should be considered a serious warning sign. The blood may result from the invasion of blood vessels by the proliferation of cancerous cells, which compromises the integrity of the prostate tissues and surrounding areas. Even though blood in the urine or semen can occur in other situations, such as infections or trauma, it is essential that this symptom be evaluated urgently. Don't wait for the symptoms to worsen. A simple test, such as the PSA, prostate-specific antigen blood test, and an ultrasound, can help identify the source of the problem. Share this information so that more men stay alert and seek early evaluation. 5. Pain in the pelvic or lower back region. Pain is a sign that should not be ignored. especially when it manifests persistently in the pelvic or lower back areas. Often, patients attribute this discomfort to muscle fatigue or spinal issues, but it is important to consider that this pain might be a reflection of prostate growth and the eventual invasion of adjacent structures by cancer. When prostate cancer progresses, it can spread to the bones, causing intense pain, especially in the pelvic region and lower back. If you are experiencing this type of pain continuously, it's time to see a doctor for a detailed evaluation. Remember, early detection is key to effective treatment and to improving your quality of life. 6. Erectile dysfunction or changes in sexual function. Male sexual health is often affected by changes in the prostate, and erectile dysfunction can be one of the early signs that something is not right. When cancerous cells begin to develop in the prostate, they can interfere with blood circulation and the nerve signals to the sexual organs, impairing your ability to achieve and maintain an erection. It is essential to understand that problems with sexual function should not be viewed merely as performance issues, but also as possible indicators of changes in prostate health. If you notice alterations in your sex life, such as difficulty in achieving or sustaining an erection, do not hesitate to seek medical advice. Remember that prevention and early diagnosis can make all the difference in your health and well-being. 7. Urgent and frequent. Need to urinate at night. Nocturia, waking up during the night to urinate, can be a common annoyance as we age. But when it becomes excessive, it can be a warning sign. If you find yourself waking up multiple times throughout the night to urinate, this could indicate an alteration in prostate function. Prostate cancer, by interfering with the anatomy of the organ, can lead to a constant feeling of urgency, even when your bladder is not full. This symptom can significantly impair your quality of sleep and consequently, your overall quality of life. Therefore, if you notice that the need to urinate at night is intensifying, it's time to investigate the causes. Consult a specialist, undergo the recommended tests, and maintain an open dialogue about your health. Prevention is always better than cure. 8. Difficulty fully emptying the bladder. Another sign that deserves attention is the sensation that your bladder does not completely empty after you urinate. This symptom can occur because an enlarged prostate, whether due to benign hyperplasia or a cancerous process, can partially block the passage of urine. You might feel that even after urinating, there is still something that needs to be released, causing discomfort and a persistent feeling of incompleteness. This sensation can lead to recurrent infections and a series of complications if left untreated. Therefore, if you feel that your bladder never fully empties, schedule an appointment with your urologist for a complete evaluation. Remember, identifying this change early can prevent future complications and help control the potential progression of cancer. 9. Urinary incontinence or unexplained dribbling. Urinary incontinence, or that unexpected dribbling even when you believe your bladder is empty, can be a silent but very revealing symptom. This phenomenon occurs when there is an involuntary loss of control over the muscles that keep urine in the bladder, and it can be triggered by structural changes in the prostate region. In prostate cancer, the impairment of surrounding nerves and tissues can lead to this loss of control. Many men feel embarrassed by this situation and end up avoiding seeking help, which is a big mistake. Incontinence can affect self-esteem and overall quality of life, in addition to being an indication that something needs to be investigated. If you are experiencing this symptom, talk with your doctor and have the necessary tests performed. Share this information. No one should suffer in silence when it comes to their health. 10. Increased prostate volume or a feeling of heaviness in the pelvic area. As time passes and cellular changes occur, it is common for the prostate to increase in size. However, when this enlargement is accompanied by a feeling of heaviness or discomfort in the pelvic region, it is a sign that should be evaluated carefully. This increase in size can be detected during routine exams or even noticed by the patient, who may feel a persistent pressure in the pelvic area. Prostate cancer can cause this increase in volume in an insidious manner, without more evident symptoms initially. That's why it is crucial for men over 50 or those with a family history of the disease to be vigilant about any changes. If you notice a feeling of heaviness or discomfort in your pelvic region, do not hesitate to consult a urologist for a thorough evaluation. Remember, prevention is the best strategy against cancer. 11. Changes in bowel habits or discomfort while defecating. Although not the most common sign, some people may experience changes in their bowel habits or feel discomfort when passing stools. This symptom can occur when prostate cancer expands and begins to affect nearby structures, such as the rectum. The pressure exerted by an enlarged prostate can cause discomfort during defecation or even changes in your usual bowel patterns. It is important to note that these symptoms can have various origins, but when they appear alongside urinary signs and pelvic pain, they should be evaluated with extra care. If you have noticed changes in your bowel habits, such as constipation, diarrhea, or pain during bowel movements, consult a specialist to rule out the possibility of something more serious. Conclusion. My dear friends, male health is something we cannot afford to overlook. Each of these 11 signs we discussed today can be an early warning for prostate cancer, and recognizing them immediately can be the difference between successful treatment and future complications. It is crucial that all men, especially those over 50 or with a family history of the disease, attend regular checkups and undergo preventive screenings. Early detection is our greatest ally in the fight against this type of cancer. If you enjoyed this video, please give it a thumbs up, subscribe to the channel, and hit the notification bell to receive updates on new content that could transform your life. Also, leave your questions, experiences, and suggestions for future topics in the comments below. Share this video with your friends and family so that more people have access to this valuable information. Remember, taking care of your health is an act of self-love and responsibility to those you care about. Prevention is the first step toward a long and healthy life, and being well-informed is essential to making the best decisions. I'm Dr. Carolina, and I will always be here to bring you content that helps you live better. Until the next video, take care of yourself.